All right, ladies and gentlemen, a story here that defies all logic, but in this politically correct world, it's not surprising, and another medical case that should have us all concerned. And joining us to talk about both of them is Dr. Jane Orient, ex-director of the Association of American Physicians and Surgeons and president of Doctors for Disaster Preparedness, and author of Your Doctor Is Not In, Healthy Skepticism About National Healthcare. Doctor, good to speak to you again. Let's start with this this plan for the federal government to spend $20 billion on an AIDS drug or AIDS drugs based on 45 cases.
Well, this plan was touted on the front page of the New York Times because there was a study cleverly named the START study to start HAART, which is highly active antiretroviral therapy, the instant a positive blood test for HIV is obtained. The study involved some 4,500 patients, and half of them got early treatment, immediate treatment, and half of them had it delayed until their white count, their CD4 white count started to drop. And it was stopped prematurely. It was supposed to go on for 3 years, but they stopped it immediately when they got a statistically significant difference, which involved about 45 patients, like 1% of the patients who were in the study. And it was touted, there's a 53% decrease in either getting AIDS-related diseases of immune deficiency or heart or liver damage, which are primarily the side effects of these drugs.
So I mean, we already spend, from what I gather, billions of dollars, I think $56 billion a year on this AIDS, HIV cocktail, as it's known, a bunch of different drugs to treat people who are HIV positive. So I mean, would this happen? In other words, if this were cancer, if this were heart disease, if this were, in my view, a less politically correct disease, if you will, or condition, would they even consider spending this kind of money on with this limited results?
Well, actually, they have with statin drugs. The Jupiter study was stopped prematurely with statin drugs for a similar decrease or advantage of maybe less than 2 or 3% in absolute advantage, but it's a 30% relative advantage for statin drugs or a 53% relative advantage for these antiretroviral drugs. But the study was stopped early, which means it was stopped before there would be a chance for long-term ill effects to be manifest. And with these can be very severe. These antiretroviral drugs are toxic. They call them 2 nukes and a third drug, and they interfere with your cellular biochemistry, and they can, over the long term, cause liver failure, heart failure, kidney failure, premature aging, cognitive decline, all of which are not going to be recognized right off.
Yeah.
And these drugs are being given to people who appear to be healthy, and many of them could live for who knows how long. We don't really know how long.
Without the drug.
Without the drug,
yeah.
Without coming down with any of immune deficiency diseases.
Crazy. All right, let's move on. There is a patient in Maryland with drug-resistant tuberculosis who came into this country from India and went through Chicago and a couple of other states. How dangerous a situation is this? How concerned should we be?
Well, this is extremely dangerous. She apparently has active infection with XDR. That's even worse than the multiple drug-resistant TB that we've been seeing, where it requires a very complicated, toxic, and expensive regimen with careful public health follow-up for 2 years or so. This is extremely drug-resistant, which means it may actually be incurable. And so not only this patient, but people who were in contact with her need to be under careful surveillance.
And they say there are hundreds, and they're trying to track them all down. Do you see this? We got about 20 seconds. Is there a chance that from this woman this will spread?
There certainly is a chance. I mean, TB is very contagious and is airborne. It's not just people who were sitting next to her, but air in the aircraft has to be recirculated.
Right, right. All right, Doctor, always great to talk to you. Thank you very much. Folks, Give Me 5 is next, but first, Daily Wrap co-host Rick Unger joins us to give us a preview of tonight's Daily Wrap, the show that follows us at 7 p.m. Eastern.
Thanks, Steve. Tonight on The Wrap, Christian religious leaders are pushing to boycott gay-friendly businesses, while presidential candidates and talk show hosts tell us that Christianity in America is now under attack. Can there be such persecution in a nation where 71% identify as Christians? We'll examine that question tonight. Then, a Texas police officer is under investigation for getting too rough with teenagers at a pool party. That officer is now answering to allegations that his behavior was racially motivated. And can Marco Rubio survive the New York Times attack on his personal and public financial behavior? We'll look at these questions and a whole lot more tonight on the Daily Wrap, immediately following the Malzberg program here on Newsmax. Hope you'll join us.